To get us started, I really just want to give a brief overview in terms of why we're kind of gathered for today's conversation. My name is Michaela Rabb. I'm a Senior Policy Associate at the Abdul Latif Jameel Poverty Action Lab, or JPAL for short. To date, there's been over 96 million reported cases of COVID-19 worldwide. Governments are grappling with tensions between implementing lockdown measures and ensuring livelihoods. So how to ensure workers' safety and health during this challenging time is vital to this calculation. Today, we'll discuss a range of policies and programs that can support workers during this time. For example, paid sick leave is critical to ensure workers can take time when ill or need to take care of sick loved ones without losing wages. And as we know, this pandemic has exacerbated existing inequalities. Women are bearing the brunt of the hardships triggered by the pandemic. Early surveys by the United Nations paint a startling picture. So for example, women are on the front line of this fight, as 70% of healthcare workers are women, and they face 3 times higher infection rates compared to their male counterparts. Additionally, the income of approximately 740 million women who work in the informal sector dropped by 60% in the first month of this pandemic. And finally, 72% of domestic workers, the overwhelming majority of whom are women, lost their job as a result of COVID-19. Generally, women tend to earn less and have fewer savings, making it more difficult for them to respond, recover, and rebuild during and after this pandemic. A greater share of women work in sectors hit hardest by this pandemic, sectors like food service or retail, and thus are at increase of job loss. And finally, they face greater responsibilities at home, now with more people in the house with schools closed and daycares closed. So therefore, we're specifically focusing today on workplace protections during COVID that might alleviate some of these challenges that working women are facing now. So this event is hosted by the Abdul Latif Jameel Poverty Action Lab, or JPAL. JPAL is a research center to reduce poverty by ensuring that policy is informed by scientific evidence. This event is part of JPAL's COVID Dialogue series, which features insights from researchers and policymakers on how to respond with evidence to the COVID-19 pandemic's most critical policy questions. Last year, we launched the Gender and Economic Agency Initiative to support innovative research and on strategies to promote women's work and enhance women's economic agency. Over the next 3 years, we are funding randomized evaluations and conducting policy outreach on women's work and economic agency, particularly in East Africa and South Asia. Today's conversation will feature a project we recently funded in Bangladesh. A special thank you to the Bill and Melinda Gates Foundation, who funded this initiative and whose investments across several grantees have deepened our shared understanding of workplace protections. I'm extremely excited to introduce our panelists and grateful for the time that they've offered today for this fantastic discussion. First, we have Julia Braun-Miller, who is a private sector development specialist at the World Bank Group. She joined the Women Business in the Law Survey in 2015, where she leads the project's Family Law Survey, which includes topics like women's legal capacity, mobility, and access to finance. Next, we have Rachel Heath, who is an associate professor in the Department of Economics at the University of Washington. Her research focuses on gender and labor markets in low and middle income countries. Next, we have Dr. Jody Hyman, who is the founding director of the World Policy and Analyst Center at the University of California, Los Angeles. And she served as a past dean of the UCLA Fielding School of Public Health from 2013 to 2018. As director of the World Policy Analysis Center, she leads an unprecedented effort to improve the level and quality of comparative policy data available to policymakers, researchers, and the public. Next, we have Mr. Josephat Irere, who is the Assistant Director for Gender for Kenya State Department for Gender. This sits under the Ministry of Public Service and Gender in Kenya. He's experienced with gender work with over 20 years in this field. And finally, we have Agnes Karuku, who's a Senior Officer of Sustainability at Safaricom. For the past 10 years, she's worked to ensure Safaricom is a rights-based company and is tracking towards achieving Sustainable Development Goals. So for today's conversation, we'll have two panel discussions. First, we'll focus on the latest research on workplace protections during COVID. And the second will feature policymakers' perspectives on workplace protections in Kenya. I will ask our panelists a series of questions to get us started today, and then turn it over to you in the audience to ask your own questions through our Q&A box. So to kick off our first panel related to research, I'll invite Julia, Jody, and Rachel to the screens. So first we'll have Dr. Jody. So my first question for you, Jody, is can you provide an overview of the findings from your recent study on paid sick leave? What is the state of paid sick leave policies around the world?
Thank you, Michaela, and thank you to everybody for joining us. It's really a joy to be here with you today. So there are lots of policies that matter enormously to whether or not workers are going to land in poverty, where they're going to get sick. I'm just going to go over a few, but we have to first see if I actually have control of the screen. Ah, there we go. Fantastic. At World, what we do is we look at what every country around the world is doing for policy. We do it for models. And I think somebody else who, as the first presenter, you always get to work out the technology side. I think that's on your side, Michaela, that it's, yeah.
Sorry about that.
It's okay. So at World, we look at constitutions, legislation, policy, education, labor force, a lot of areas that matter to all of us as we're facing crises. Today, because of the shortness of our time, I'm just going to present two, but if you want to learn more, go to worldpolicycenter.org. It's all freely downloadable there. Sick leave. Michaela already mentioned it. Why does it matter so much? It matters to spread, because if you're sick, if you are going to lose pay when you're sick, you go to work sick, everybody around you gets sick, you can't afford to stay home. It matters to people's income. And there's data on this from around the world, but what do we see in terms of who has it? And Michaela, I'm going to need to let you advance the slides, please. So if you want to answer how well sick leave is working, ultimately you need three things. At World, we work with partners around the world and we welcome your partnerships to do three things. What is the policy? In this case, do people have a right to sick leave? Is it being implemented? And is it getting linking that to the outcomes? Let's start with whether anybody has it. Next slide, please. Next slide. So here's the one good news slide. There's going to be a lot of not so good news. This, by the way, if you're in the United States, India, Somalia, it's not good news everywhere, but it's good news in most of the world. So 181 countries around the world have some national legislation guaranteeing paid sick leave. Two of the major economies that don't still have it, India in sectors. South Korea has a version of paid leave that can be used for sick and other annual leave. But the United States is a major economy, had none going into this pandemic. It had it temporarily. It's lost it again. The few others without, Somalia, Sri Lanka, and 6 South Pacific Island states. But that's just part of the question. In COVID, we're asking people to stay home for 2 weeks. Can they stay home that whole time? Can they afford to do it? And importantly, who in each country is covered? Next slide, please. So this looks at the question of, do you have at least 2 weeks? You know, can you stay home long enough? Now, that's not going to take care of people who get gravely ill. You can already see that the countries that meet an International Labor Organization standard, that's the well-paid for at least 2 weeks, diminishes greatly. So there are many more countries without that amount of leave. Next slide, please. The biggest gap, though, is in who is covered. And I do want to spend a minute on this. We know how many people are in the informal economy. Michaela already talked about the loss of income in the informal economy. Well, in low-income countries, only 7% cover self-employed workers with sick leave. Even in high-income countries, still a third don't. And in middle-income countries, nearly 2/3 don't cover the self-employed. So there are large gaps. What you're seeing on this map also includes those who don't cover part-time. Why do we care? Because there are so many people who are cobbling together multiple part-time jobs and completely dependent on the income. Next slide, please. Part of what's happened across all our countries is the economies have gone south in terms of lowering their numbers of employed, is that we have had immense job loss across southern countries, northern countries, east, west, all economies. But it's not just job loss. And here I'll give an example from the United States, just last month's numbers. Huge job loss, but men who were from a majority ethnic group, white men, did not lose jobs. They gained jobs. Who lost jobs? Women lost jobs. And not all women lost jobs. Women of color, women from minority groups who faced more discrimination were the ones who disproportionately lost jobs. So I want to take my last just 2 minutes to quickly say, we have to worry not only about sick leave, but these health crises have huge economic consequences, both for the health of people and their economic outcomes. We need to know whether everybody's equally protected. Next slide, please. This just shows a little bit about the guarantees for men and women. The short story is that when it comes just to sex discrimination alone, most of the world recognizes that there shouldn't be sex discrimination in employment. Next slide. When it comes to firing, for example, 89%, so overwhelmingly countries do say you can't discriminate on the basis of sex at a national level, but not every country does. And some of those countries with gaps, maybe states are protected, maybe certain sectors are protected. India, much of the law is sectoral, but not the entire country. So this is there a national protection? Next slide, please. But where you see the map start to get redder is who's losing jobs with intersectional discrimination. I told you the numbers in terms of biggest job loss, women of color in the United States. This starts to show what we see around race, ethnicity. There's less protection. So globally, nearly 1 in 4 countries don't protect from firing discrimination based on race, ethnicity. And when you talk about the numbers in Asia, it's over 60% don't. Next slide, please. Importantly, because it's such a large reason in the pandemic for women getting fired, there's very little protection around the world. The red countries are all the countries without it that protect from discrimination based on family status. So if an employer decides that this worker is spending so much time caring for their family that they want to fire them because they see that as as a disproportionate risk or disproportionate problem, whether amidst the pandemic or not, the protection is not there. I think that may be my last slide. You want to go one more? We'll see. Again, parenting status, you see it there. So I'll wrap up just for time and say, what we do around income matters, what we do around ability to work, children going to school matters, and the ability of people to take preventive measures. At the workplace, the biggest preventive measure in place is sick leave. There's great starts in most countries around the world, with a few notable exceptions. Hopefully transition in the United States will change that here. But there are huge coverage gaps in the informal economy. We also have to worry about workplace protections for essential income. There, we have to especially worry about where the opportunities for discrimination mean that job loss burden is disproportionate based on race, based on gender, based on other group experiences. I'll look forward to talking more and pass it over to the next person, even if there's another slide, just because of time.
Thank you. No, Jody, this paints a wonderful picture. I guess not wonderful, but definitely gives us an overview exactly what policies are looking at and really where are these critical gaps that need additional attention to. I'll turn it over now to Julia, who's been doing some work also at kind of this global survey level. Julia, can you give us some background on the Women, Business, and the Law survey and how have governments adapted legal protections for women during this time?
Yeah, thank you, Michaela, and thank you, Jody. I see lots of overlap between our research, which is very, very interesting. And thanks for everyone for being here and zooming in. I think, Michaela, also I cannot, yes, I can control. No, I cannot. Yes. Okay, excellent. So let me just start with a very brief overview of the Women, Business, and the Law project at the World Bank, for those who are not too familiar with it. It's a project that measures the legal environment and how it supports or hinders women's work. We have created 8 indicators that look at legal differences, basically where the law is different for women compared to men, when it comes to decisions about work. And that starts with women's freedom of movement and mobility to setting up a business all the way until receiving a pension. In the project, we measure 190 countries all around the world. And one of our main findings is that on average, women have only 3/4 of the legal rights of men when it comes to economic empowerment. So there's huge room for improvement in almost every country around the world. And what our research emphasizes is that these underlying legal barriers really matter. And they're kind of a big piece in the puzzle why women's labor force participation around the world is lower than men's and why there is a gender wage gap. So I want to give examples that matter today, since we're talking about the COVID-19 crisis. And there are basically 2 main reasons why the crisis disproportionately and negatively impacts women. One is that female-dominated industries like retail and services are heavily affected by the crisis. And the other reason is an uptake in care responsibilities because of school and kindergarten closures, which has forced many women to either scale back at work or leave the labor force completely. So let me advance the slide. No, it doesn't work. Yes. Just to the first point, sectorial job segregation. We know it's not working. That's fine. Sorry about that.
There's a lag on my end. I can advance the slide if you want to just tell me, Nick, which one.
That's fine. Let's just keep this one up. The 2 points that I mentioned, sectorial job segregation. What our research has found, why the law matters for that, is that in 90 economies around the world, they still restrict the jobs that women can do compared to men. For example, in Ethiopia, women cannot work in jobs deemed dangerous like men. And India restricts the jobs that women can work in factories and mining and at night. And so of course that adds to this gender segregation at work. The second point that I mentioned is caregiving responsibilities. We also measure that in our indicator called parenthood, where we look at parental leave policies. And the good news is that most countries around the world offer maternity leave of 98 days, which is the internationally agreed upon standard by the ILO. Another good news is that half of the countries around the world that we measure also offer some form of paid paternity leave. However, the median duration of paid paternity leave is only 5 days versus maternity leave is 98 days. And we know that in general, women before the pandemic already worked about 4.5 hours a day in unpaid work at home and care work and domestic work, and men only work half of this time. And the data that's emerging is that the pandemic is exacerbating this gap. So we really need to think about how can we increase fathers' participation in care work and paternity leave, and how can we redistribute this unpaid work at home. So in order to understand these policy measures that countries around the world have adopted, we introduced several new questions in our surveys where we collect data around the world. And 3 important themes have emerged when looking at the COVID-19 crisis and its impact on women entrepreneurs and women employees. One is childcare. Another one is access to justice, particularly the family justice system. And the third area would be health and safety, and that includes protection from domestic violence, because we've already unfortunately heard a lot of evidence that domestic violence is increasing because of lockdown and because of economic concerns. But as we're talking about workplace protection today, I'm just gonna focus on the first area and measures that we have seen. So childcare policies. One main finding is there is a lot of movement. A lot of countries have reacted to this crisis among childcare and this additional need for childcare. 40 economies around the world introduced leave or benefit policies specifically to help their employees better reconcile their jobs, their work obligations with expanded childcare obligations at home. But something that Dr. Jody already mentioned, the big gap that we're seeing is that eligibility is often tied to formal employment. Informal workers wouldn't get any benefits. And we also see a wide variety of measures. Wage compensation can range from 70% wage. It's a very gracious policy in France. In some countries, it's not paid. Additional leave can range from 3 days to 3 months. So really lots of differences that we see. Another measure that's really important is childcare for essential workers. What about these workers who cannot stay at home, who cannot afford to take care of their children? And there we're seeing some innovative measures also that countries mandate childcare centers to stay open for children of doctors, of nurses, grocery store workers. For example, in Singapore, in New Zealand, we have seen that. But the main question, what about those workers, again, that cannot even afford to take leave, that cannot homeschool their children? What are other measures, innovative policies to support? Italy is an example where childcare benefits were given directly to parents in the form of babysitting vouchers, or another measure would be tax credits. It's something we've seen in the UK, tax credits for parents, but also tax credits for the childcare industry itself. For example, childcare centers have been exempt from paying a certain property tax. So summing up, we have seen a lot of movement. It's really promising, but a caveat is that most of these policies are concentrated around high-income economies, and also most likely they're not sufficient to really solve this gender gap in care work. So I want to end kind of with this appeal to think about how can we redefine the value of childcare as an essential activity, because childcare is an essential activity for our modern prosperous economy. And here I really mean the professionalized childcare industry as much as the childcare work that's done at home. And we need to think, how can we encourage men's participation in both uptake of father's leave and really see childcare as an essential activity to contribute to our economy.
Thank you, Julia. I really think that that kind of provides important framing for exactly why this issues matter and what are people doing to address it. I think also I'm excited to think about exactly how men are being involved in this, not just women's work, and that we need to elevate childcare to that essential status as you discussed. So thank you for that. My next question is for both of you, Jody and Julia. What do you think are important research and policy gaps, and how can research help close those gaps maybe on the policy front? So happy to turn it over to Judy or Julia, Julia, who would like to go first?
You're welcome to, Julia. I'll go second.
Okay. My voice is warmed up right now.
That's right.
Yeah, thank you, Michaela. Yeah, it's great since we're talking about research. One thing I'd like to emphasize is that we measure the law. However, we always try to correlate our legal indicators with actual outcome measurements, such as women's labor force participation. And that's what we continue to see, is that the law matters. Where the law is more equal, we see more women work and be empowered. But of course, there's other research programs like randomized controlled trials that I think are incredibly valuable in assisting with research and seeing what works. So in terms of areas and of gaps, I like to look at it from different levels, because there's really gaps on every level. So it depends, where you would like to focus your research. If you look at the macro highest level and international comparison, is this big gap between high income and low income countries, right? And so we can see what can one country learn from the others? What are policies that work in any setting? On the country level itself, employment policies, Dr. Jody mentioned, I mentioned a little bit this idea that informal workers are often not protected by social protection programs. So what are other measures, direct cash payments, tax benefits, tax subsidies, so that we can reach all women with our programs? And then in country also the vulnerability of the childcare sector that I mentioned earlier. I think it's really important that we start developing a long-term strategy to establish a resilient childcare sector, because the research that has already been done across the world shows that if there is public funded childcare, public or private, and that's research from Argentina to Germany to Vietnam, around the world, it increases women's labor force participation. So it's incredibly beneficial. And the last area within the family, if you're looking at intra-family relationships between men and women, how can we redistribute the care work? How can we make sure that women are not the ones bearing all the main brunt of care work?
That's great. And there's so much synergy between what Julia and I have to say. It's a pleasure to build on that. I'll start right where Julia ended, which is, can we shift gender equality in the home and say we do have some terrific new data on this when countries pass paid maternity leave? So these are rigorous longitudinal design studies across dozens of countries. When countries pass sufficiently long paid paternity leave, it doesn't have to be that long, but it does have to be more than a couple days. So even a couple weeks, it increases the attitudes that both men and women are important in the workplace. When paid maternity leave is passed, consistent, long enough and paid at the level that people can take it, so just globally agreed to standards, again, it also shifts attitudes both at home and in the workplace around gender equality. So I think that is achievable. But we are asked to talk about gaps, so I do want to talk about those. First, some of the countries that now have paid childcare leave or paid sick leave are doing it just on an emergent basis. That's important, that's valuable, we need it during this crisis. But this is the fourth time in the last 20 years alone that there's been an emerging disease that's a major respiratory infection, readily transmitted. If you include bloodborne like Ebola, then the number goes up. Countries need to have these long-term protections in place So we need to make sure that's happening. On the research side, we need more research into what works in the informal economy. You saw that I shared the numbers of how few countries, relatively speaking, are covering it, but some are. Let's study what's working, what's successful. The child care data we have is not enough. While we can map around the world what people have access to in the workplace, and while both WBL at the bank and the World Policy Analysis Center have begun to map what's available 0 to 5, we just don't have enough information on that. We need to be able to have models for all countries around the world. We need to make it easy for civil society and for policymakers to be able to select their own comparators and look at what's going on. Finally, one area we haven't, well, two final areas, one on childcare, which is we've talked about parents, but many children are cared for by someone else. They're cared for by a grandparent. They're cared for by an aunt or uncle or other extended family. We need to look at what's available for other primary caregivers to take the leave they need. Finally, we've spent a lot of time on children because it's so essential, but when you think about care and crisis or care and gender, elder care and care for adults who are seriously disabled or in need of support is also a very gendered activity. It's growing in every region around the world. And we urgently need to try to begin to address what's the workplace doing around elder care and what are the societal supports. I'll stop there.
Thank you so much. I think this kind of call for new research on these topics and kind of what these gaps are transitions very nicely to talk about the work that Rachel is working in Bangladesh to do, and really aligns with our mission at the Gender and Economic Agency Initiative. We're really trying to help address some of these research gaps for policymakers. And so Rachel, I was wondering if you could talk a bit more about your work in Bangladesh on paid sick leave and kind of what are you learning through this process with your partner organization?
Yes, well, thank you to Michaela and the whole JPAL team for organizing this, and thanks to all the attendees for being here. So I have some slides to show you. I'll see if they're working. Yeah. So yes, just by way of introduction. So I mean, and I really appreciate the kind of broad overview from Julia and Jody on kind of worldwide what's going on. And so we're now going to kind of zoom into kind of a specific kind of case study looking at the Bangladeshi apparel industry. And just to mention, this is joint work with Laura Boudreau at Columbia and Wahed Rahman, who's at Brack University in Bangladesh. Actually, I lost the slide. So maybe Michaela, I will ask you to announce. I lost the little arrow again. Okay, yeah. Okay. Thanks, Michaela. So yes. So this project we're actually, can you go? I think we skipped a slide, Michaela. Yes, thank you. So just by way of brief introduction. So, you know, apparel factories can be difficult places to work. You all probably remember some of the kind of very tragic workplace, fires and factory collapses that have, you know, really been quite tragic. But even kind of for workers that don't face such kind of severe injury or death in the workplace, they're quite hard places to work. So some of our colleagues at Brack University did a study a couple years ago, and, you know, one kind of thing that kind of came out of that study was that 88% of respondents of the study witnessed some kind of harassment, whether it's physical, verbal, sexual, or humiliation by management, at least monthly in their factory. So it's quite common for workers to face some kind of harassment. So that's kind of the baseline even coming into COVID. And, you know, I think kind of, I mean, we have really good reason to believe that, you know, that COVID-19 is, you know, kind of made it even harder. So what's happening during COVID-19 in garment factories is that, so factories have kept operating almost through the entire crisis. They were exempt from government mandated lockdowns, and the government really recognizes that they're essential for the economy to keep going. But at the same time, as workers have mostly kept working, many factories have had a lot of their orders canceled, which has led to, workers not getting paid. And in April, that spilled over to demonstrations by workers who, in the extreme had not been paid at all for 3 months. So, workers are keeping working, their pay might be, their pay might have been lowered, and, kind of everybody's under increased stress. And from piloting data that we've done, there's evidence of transmission of COVID-19 on production teams amongst workers that work in close proximity to each other. So kind of, a job that's already hard, workers are now facing kind of, additional challenges. Next slide, please, Michaela. Amidst this background, what we've done is started a project that's in collaboration with the managing director of one of the largest garment manufacturing firms in Bangladesh. The managing director actually reached out to us, and he's interested in improving worker well-being and worker-manager relationships. So things such as, we've talked about paid sick leave. So in this particular factory, the official policy is indeed that workers can have paid sick leave. They're entitled to that. But the managing director told us how there's this issue that, the workers apply to their line manager, the manager that works most directly with them, to get the leave. And sometimes the line manager, who's very focused on immediate production targets, won't pass on that request. So that kind of tying into some of the, the legal challenges we saw from Julia, what we've uncovered is that even if their workers are, entitled to something, there's maybe kind of difficulty, kind of having it actually kind of come to the workers. So that's one thing that the manager is focused on, and also just decreased incidents of shouting from the lower level managers and other abuse. So, the goal is very much, to kind of have workers, kind of better wellness, both, physical and, mental, and, which would, the goal is to decrease turnover. And if this works, then, if any strategies to address this works, then this is great, because this is, good for the workers who depend on the income here, and, they'll, they're less likely to leave, they'll keep the income, they'll, have better physical and mental well-being while they do so. And the firm will also, benefit from that decreased turnover. So if we can, design something that works, it will really be a win-win. Next slide, please. So kind of specifically what we're going to do is we're now working on designing systems where workers can feel comfortable reporting managers' behavior. Because of course there's, there's a whole question about, even though we're coming in as an independent study team, are workers going to feel comfortable telling us, kind of about, managers' misbehavior if they fear retaliation. So we're kind of experimenting with a bunch of different ways to try to build rapport with the workers, preserve anonymity, and kind of make them feel comfortable reporting. Once we have that data in hand, we're going to do a descriptive analysis to kind of discover, kind of what makes, within this very large factory, what makes some teams, kind of high performing, good relationship between workers and managers, and conversely, what makes, kind of relationships break down on other teams. So with that, with that kind of analysis in hand, the next step in this project will be to do a randomized controlled trial where we experimentally convey the upper management priorities about worker well-being to both workers and lower level managers to see if this is kind of, this kind of information will be enough to improve relations. Next slide, please, Michaela. So what I'll do now is to take just a couple minutes to give you some results from piloting of this study and a complementary survey of apparel workers that with the same research team that is kind of meant to give a broader kind of community level perspective, not just about this one factory, but what's going on, kind of amongst, in apparel factories more broadly. Next slide, please. So let me first just point out that, I kind of started by saying some reasons why we think that apparel, kind of might be a particularly hard place to work during the pandemic. And that's true, but at the same time, it's at least earning wise, it's often, kind of still an important thing for workers. So what I show you here is workers that are currently still in the garment sector, their earnings throughout 2020 versus workers who had left the sector before the beginning of 2020 or after 2020. And what you see is that workers did miss earnings in April, kind of corresponding to the protests that I told you about. But the blue lines that show both male and female garment workers, rebounded, by summer, whereas the earnings for women workers in particular that no longer in the sector are, still quite low. So it just kind of emphasizes, it's kind of, from a policy standpoint, it's really valuable to try to improve working conditions in garment factories so that women can kind of benefit from this stable earning stream. Next slide, please, Michaela. But, at the same time, there is, are increasing stress levels on average. But, another thing I want to point out is that it's quite heterogeneous. So, the modal response from workers is that indeed, COVID-19 has increased stress in their workplace. But a non-trivial number of workers actually say that, their stress in the workplace has decreased. So that really emphasizes our focus on trying to understand, why are some teams having good relationship between workers and managers and others less so. Next slide, please, Michaela. And the same goes with abuse from management. So what we have here, or what we're showing you here, is a scatter plot that that shows the relationship between management abuse in January, where, as you can see the note at the bottom, kind of higher numbers represent more abuse, and current abuse. There's quite a lot of heterogeneity. In some workplaces, abuse has stayed about the same. In others, it's increased, and in many, it's actually decreased. So really kind of trying to, again, motivating this focus on trying to understand, why is abuse going up in some places and down in others. Next slide, please. So, thinking a little bit about COVID-19 in the factory, and now I'm turning to telling you just a bit about the pilot that we've done with our partner factory. So that's specific to that factory. In the piloting, we found that, we have no way, we didn't do formal COVID tests, but we asked workers about COVID symptoms. So, and workers are indeed 9 percentage points more likely to report COVID symptoms for every other surveyed worker on their team who also reports symptoms. And that's even stronger in the sewing section where, again, workers are working in quite close proximity. So it shows that, there is some evidence of COVID spread in factories and kind of really highlights the gains to making sure workers can take sick leave if they feel ill. It also shows, teams aren't just, kind of sources of contagious disease. They're also important sources of information. It looks like, workers are more likely to know about COVID if others on their team do as well. They're more likely to be concerned about COVID if others on their team do as well. And there's also correlation in teams in COVID prevention behaviors, things like mask wearing and hand washing. So again, it looks like, the team is a really important unit within this factory where, both kind of positive information and, illness can spread. Next slide, please. So just to wrap up and, and then I'm excited to talk more in question and answer. So, I've shown you evidence that working conditions in garment factories, on average are getting worse during COVID, but this is not at all uniformly felt by all workers. In this environment, we're going to, we're working on and we'll ultimately do an experiment that tests whether conveying upper management's concern for worker well-being can improve worker outcomes. So thank you so much, and I'm excited to hear everybody else and potentially answer questions.
Thank you so much, Rachel. And this is really exciting. We were excited to fund this work in our recent rounds for funding around COVID projects for the Gender Economic Agency Initiative. So thank you for sharing some of the background and longer perspective in terms of how this project has developed over the time. So thank you for that. Now we'll turn it over to
thank you, Michaela.
Turn over for questions, answers. I see Julie's responding to a few directly, but one that I see popping up in our chat is that from Benjamin, who's interested in thinking about the intersection between income and, no worries, Julia, I see you laughing, looking at income and childcare preferences and responsibilities. So thinking about how higher income fathers may be taking on more responsibility during this time, or is unpaid care work increasing regardless of debt, regardless of wealth? So Julia, see your response in the chat. Do you want to expound in any way, or Agnes, or sorry, Rachel or Joe, do you want to jump in at any point? And please feel free to also ask questions of our panelists in the chat, in this Q&A box as well, as we have some time for questions.
Yeah, basically what I said, I think employer-supported childcare is a very powerful tool to keep female workers, retain them, reduce worker turnover, but there can be a negative effect that it may discourage employers to hire female employees if they're mandated to provide childcare. So that's like the big caveat. So I think what's important is that, you know, the cost is not borne by the employer. We always should think like what benefits the women and what does not disbenefit the employer. So really government subsidies, tax cuts, and other more universal policies are probably better. And I highly encourage you to look at the IFC website, which has done great work on that. And also Women, Business, and the Law. In our new report, we're starting to lay out several research areas on that. So I encourage you to look at that.
And I can build on that a little and say that what Julia's referring to in terms of disincentives, there are really two parts of that. One is laws and policies that only guarantee childcare at the workplace for women. Those are the most problematic in terms of discrimination because it incentivizes employers not to hire women. A number of countries have transformed that to be guaranteeing childcare for everyone, regardless of sex. Jordan is an excellent example of this, that long had childcare guaranteed, implemented it more recently, and then made it across sex. And that's an excellent start. But to Julia's point, the most powerful approach remains having public responsibility for financing. And the reason is, while we can reduce discrimination based on sex, you still have, as my slides illustrated, the potential for discrimination based on parenting. So it's easy to guess who's likely to have children in the next couple of years, who already has them. So we don't want disproportionate costs for childcare on employers who are hiring people with young children. And the approach to that is more of a shared insurance model or a public education model. Last note on the power of this, we have data across countries that do offer from a national level free pre-primary school. So that's the first step. We obviously need to take it back more years, cover more of early childhood. And there are higher levels of successful primary school completion, higher levels of going on to secondary school. So it's a powerful economic engine.
Thank you so much. I think I've learned so much in this process, especially thinking about those kind of model nations and policies out there, for example, like Jordan that you highlighted, and thinking about how we could work to make these countries like the role models for other countries to follow along. So thank you for sharing these powerful examples.
And maybe to the question about whether there are class differences that was in the Q&A, and it used the US as an example, but I have no doubt it's relevant across countries in terms of the burden across gender amidst the pandemic of caregiving. I just want to say it's an incredibly important question. I don't think we have the data on it yet at most national levels. It's important not only for seeing where the burden is, but it would be it'd be informative to know whether those who actually have access to more purchased childcare, to more who can afford it when governments aren't putting childcare, elder care, sick care in place, how they're able to respond.
Wonderful. Thank you so much. And I think seeing no other kind of questions in a Q&A box, I'll take this time to thank you all, Julia, Rachel, and Jody, for your wonderful words and really laying out some of these global policies and your work happening in Bangladesh to really give us a really grounding on the latest evidence that is happening in this space. It's been really formative for me to listen. So thank you so much for your time today. I'll now transition.
Thank you so much. And I'm so sorry to interrupt. I do want to highlight though, one quick thing on the, more thing on the class question. Absolutely, we know that the greater burden of the pandemic has been in poor neighborhoods across countries, in densely inhabited, in the worst working conditions. So regardless of what's happening in higher income settings, which was what the Q&A, for those who didn't read it, was referring to within country, there is for sure this large class disparity in the burden of care to begin with.
Thank you, thank you. I also saw one question around apparel industry work, so maybe defer that to you, Rachel, to answer via the chat. And take this time to transition to our next panel. First, I would like to now introduce back up to our screens, Mr. Rere and Agnes, who will kind of give us a perspective of what's happening on workplace protections in Kenya. So first, I'll turn it over to Mr. Rere, and thinking about how does this global evidence that our previous panelists shared resonate with your experiences developing policies and implementing programs on these topics in Kenya. I know you have your slides, so please feel free to share your.
Hello. Thank you, Michaela. And thank you also, Judy, Julia, and Rachel, who preceded me as a third panelist. For the panelists, I also learned the risk of repeating what my colleagues have spoken about the global perspective on the impact of COVID-19, especially on women and protection of women at the workplace. And I think they have very well highlighted about the macro, the micro perspectives of the effect and impact of COVID-19, especially on women, both in the formal and informal sectors of working. And I think they have covered that very well. For Kenya, to answer the question on how we have interacted with that, we have had a big challenge in terms of women who are working. In terms of loss of jobs and therefore livelihoods, that's which is reflected at the global level in the US, in the big economies. It's also what is happening in the small economies and growing economies. So the impact has been transferred, especially to women and people working who are having lower incomes and people living in informal settlements, as has just been highlighted. So we have experienced that. Also, besides the loss of job and livelihoods, we also have a very critical area that needs further research and also discussion, and that is the challenge to the gender division of labor, issues of masculinity, what men do normally and what women do normally. There has been a challenge with the restrictions on movement in terms of COVID-19, the stay at home. So the division of labor, as has always been gendered, has now had a challenge on who can do what and who must do what now. So that has happened, and it has had a wider impact in terms of psychological effect on men and women, because people have now to do what they have not been doing before, and that is a challenge on the roles that have been given to them, and particularly on masculinity. So some of the crises we see at the domestic level, including intimate partner violence at that level, is out of those frustrations, out of having to redefine what we do as men and women in the light of the division of labor. So that has happened across the board, but more so with the lower income categories of our populations. In Kenya, I know it has been captured well by the previous presenters at the global level. Then we have also seen increased pressure to fill the gap for providing bread on the table. Now that men and women have been laid down in informal work, and the income that they get from informal informal working has also gone down. And the size of the same size of bread is still required at home. So there is increased pressure for women to provide that bread, which has always been there. Whereas the income have been sliced, but the size of bread requires to be the same at the domestic level. So that pressure has again gone up, which again has contributed to the psychological and emotional well-being of both men and women. Again, there has been an increase, and this has been captured well on the care economy, that women, even when they are working in informal job locations, they still have to give care to provide for what we are calling the care economy. Previously, before the COVID, there were coping mechanisms based on the economy at that time. But these were different times, challenging times in Kenya, where now the rise in deficit in the provision of the bread then increased the burden also, and now lack of that bread coming to on the table because of people losing incomes and losing livelihoods, shifting the burden, a lot of burden for provision of that care for women, because the children at home, the husbands at home, we are us at home. So in a day of 24, in a 24-day program, there is what we can now call a poverty of time, because we're working with the same hours we've been working, but with more demands from the children who are previously taken care of within the school system by the teachers. So they have to cook, they have to wash, they have to take care of the emotional requirements of both the children and the larger family. So that also has increased the risk of psychological and emotional vulnerability for especially women, working women. I think that is our interaction as a country with the issues of the global evidence that has been put forward here in terms of policies and programs. But I want to say that given this scenario, the country has been able also to rise to the occasion. Kenya was as unprepared with COVID-19 as any other country because it was not expected. So we had to do things things unusual, what we call business as usual, and therefore it gave us an opportunity to interrogate the existing programs, which are many, which captures the spirit of providing a fallback position for persons falling into vulnerability. So those programs have been there, but this COVID has given us that opportunity now to challenge and to look at those policies and programs from a new perspective, because the impact, because of the differential impact it has had on men and women. So I don't know whether we have that opportunity to talk about some of the policies that have been brought into place, but some have been put in place in tandem with what is happening given the global evidence. And I think some of our response mechanisms in Kenya have been informed by what the World Health Organization guidelines and guidance has been as a leading health body. And one of them, as I know, is that the World Health Organization put in place what we call the strategic preparedness and response plan. So in Kenya, we have replicated such a mechanism at the national level, bringing together key stakeholders so that they are able to inform government on the next action to take, and the action to take given the current situation. And some of the response based on this preparedness is we have come up, for example, there are many, I'll mention a few, is the National COVID-19 Response Plan, and that which also goes beyond COVID-19 in terms of gender-based violence and also female genital mutilation, because female genital mutilation has gone up now that children at home, especially in communities that practice, the children are there for longer periods. So those who practice have had time and opportunity to plan for them to be. So our response has also been informed of what is happening. Again, I know the World Health Organization also came up with what they called COVID-19 Solidarity Response Fund. Again, in our country, in Kenya, immediately after the declaration of the pandemic, the government came up with what we call a fund, COVID-19 Response Fund, where both the government, citizens, all citizens, and also the private sector and other stakeholders who are involved in contributing towards that basket. So these have been some of our response mechanisms in view of what is also happening in the world, and borrowing from the guidance that has been given and leadership given by the World Health Organization. So I don't know whether I've captured the spirit of this, the world scope as it has been taken by Kenya as a country in response to COVID-19, especially protecting the vulnerable, and the vulnerable particularly concerns women who have lost income, but who are also suffering psychological, emotional vulnerability on account of the demands being laid upon them. Yeah. Michaela?
Thank you, Mr. Rure. I think you raised such important points around gender-based violence that Julia touched on briefly, but really that this is something that's quite concerning during this time. I also appreciated how you thought about taking this as an opportunity to reevaluate some of the policies in place, rather than kind of being nimble and being very nimble in your approach. So thank you for outlining how the ministry has been thinking about some of these topics. I now want to turn it over to Agnes and have talk about the work at Safaricom as a private sector actor, one of the largest telecommunications companies in the continent, I believe. And so how did Safaricom develop its policies to support working parents? What are lessons learned for employers when implementing these sorts of policies?
Thank you, Michaela, and thank you to all the panelists that were before me for setting the background, and Mr. Ireri for giving the Kenyan context for this. And I'll say, as you said, Safaricom is a leading communications company operating in Kenya. And when we were developing the family-friendly policies, that was even before COVID. And the aim was mainly to have Safaricom as an employer of choice. So that was the first aim that we had when we were developing the policies. So some of the policies that we had in place was an extended maternity leave for 4 months for the women, 2 weeks for the men. We have a crash facility, at least in two of our the headquarters. And that caters at no cost to all the employees, whether it's male or female, for any child above 6 months. And we also have the comprehensive health insurance for the parent and the children, as well as a flexi working policy. So like, for example, if a mother comes back from maternity leave, she's allowed to work for 6 hours a day so that she's able to breastfeed. I mean, the aim of this was when exclusive breastfeeding is important for children up to 6 months old. So establishing these workplace protections, as I said, came up as a result of Safaricom wanting to be an employer of choice in the beginning. But the other thing that we used, or the other reason why this was, that motivated the family-friendly policy was, we have a target of achieving gender balance within Safaricom at all levels, whether it's senior management or middle level management. That's by 2025. So some of these policies, again, were developed as a way of helping us achieve our target of gender balance at all levels by 2025. And so some of the things or programs that we have in place to help us now achieve that include a Women in Technology program. I think it's Julia who mentioned that women are usually given certain roles. I mean, what is normally considered the soft skills. And being a telecommunication company, we notice that women are not taking up the technology jobs as much. So the Women in Technology program seeks to encourage women to take up roles in technology. And so we have a training program that starts all the way with university students joining us for internship programs, and the majority of the students are women. Reserved positions are reserved for women. So we also have women in leadership. Again, it was mentioned earlier that women are mainly in, they're not in leadership positions, probably because of the childcare responsibilities that come, or you find that women are not able to scale to higher leadership positions because of family care responsibilities. So we have a Women in Leadership program that's able to grow women from middle management to senior management levels. And lastly, one of the other I can mention in terms of a program we have so that we can be able to achieve gender balance by 2025 at Safaricom is Women in Business. Now, this one caters for our stakeholders, our suppliers, whereby we've reserved 10% of our procurement spend to women-owned businesses. And we have trainings and capacity building sessions to even encourage the women suppliers to take up the roles in fields that have not been, because usually you'll find women suppliers are in fields like decor, events and so on. So we are diversifying and allowing women to take up roles in, for example, building up such roles that would normally be considered gender biased. Mainly they are men who lead those roles. So what has been the motivation for us even before COVID or maybe I can go to what the changes were after COVID came in. So what we had to come up with a COVID policy and guideline as Safaricom. Our health and safety policy was revamped, and we had measures in place now to assist the employees, especially basically across the genders, but we had an implementation of work from home policy. So all staff, about 70%, majority of staff were working from home. And the first frontline staff that were requested to work from home were lactating mothers and pregnant mothers. So you find that maybe as a telecommunications company, we have the retail sales shops that, it's not possible maybe for a pregnant mother to work from home if their role is within the shops. So what we were doing in such instances is upskilling or doing job rotations for such staff to allow them to experience or have an experience of a different kind of job that they would want to do, to allow them to be able now to protect the unborn child as well as maybe the lactating child. So those are some of the things we did. That's one of the things we did during COVID. Also, we did, as Mr. Ireri mentioned, there was an increase rather in terms of gender-based violence when people started working from home. So what we did is we provided counseling support for staff and their families to cope with the changes that came up with working from home or the changes that came up during COVID. We also did COVID testing for the employees plus their immediate family members, and anybody who was found with, to have been COVID positive, there's paid sick leave, and the insurance was able to cater for their medical expenses. So those are some of the things that we had put in place after COVID. But what I'll mention is what motivated this, as I said in the beginning, is for Safaricom being an employer of choice. But what we've noticed, and you asked this maybe, you think most companies want to operate responsibly, but they're afraid of the cost involved in doing such or having such policies in place. But according to a report by Business for Social Responsibility, companies that invest in developing responsible practices achieve the benefits through improved productivity. And this is something that we have seen at Safaricom. So the cost implications brought about by those family-friendly policies, we've seen, like, for example, working women being able to, less cases of absenteeism because of childcare responsibilities associated. I, for example, have had an experience, or one of the testimonials we've had is, for example, a lady who has a child with special needs. So you find that finding childcare for such a child is so difficult. You keep changing childcare because the child is not necessarily easy to deal with. And if somebody is not experienced in dealing with a mentally challenged child, then the parent has worse experiences. So the experience with having, you would find that she would miss work most of the time, but because of the creche facility that was introduced at no cost, then she's able to come with a child to work, and the trained facilitators or the trained specialists at the creche facility are able to take care of the child well. So those are just some of the things. You think about it. how many times would she have missed work? Or if you check the record of the number of times she missed work, vis-a-vis now when she started coming with a child to work. So there's been greater productivity levels, reduced absenteeism, and the staff are more motivated. And you find that, as Julia was saying, some companies fear investing in that because of the cost involved, but or hiring women because of such instances. But for us at Safaricom, we've noticed that yes, the cost implications may be high at the beginning, but when you look at it in the long term, then there are benefits to operating in that way. So I'd stop there for now.
Thank you so much for sharing, Agnes. It really is like inspiring to see what Safaricom is offering and how comprehensive the policies are, especially when just given most employers are quite lacking even the basics, and to see how Safaricom is going above and beyond to really support working parents. So thank you for offering that, providing that kind of background into the organization. And Mr. Herrera, I wanted to ask, kind of go back to your previous remarks around how the government has been adapting during COVID-19. I know there's been many policies in place during this time, and we'd love to hear a bit more about how the government has adapted or created policies to protect women during COVID, and what gaps have the government seen in its interventions, and what lessons is it taking forward to enhance women's economic empowerment during and beyond this pandemic. So I invite you to kind of give some remarks on that as well.
Okay, thank you, Michaela, about regard to that and what we have provided. And I also want to thank my colleague from Safaricom from that elaborate presentation. And I've said some of the response mechanisms the government has put in place, but you also have seen some challenges. Allow me to talk about some of the challenges because they also inform the lessons that we learned. So some of the challenges that we have got as government, working with partnership with the private sector and other stakeholders, is the issue of data, availability of data, because we are not prepared for this situation. So when it arose, we had the issue of getting accurate and timely data on the extent and the impact of the COVID-19, especially on women, and especially women who are working. So even the response mechanism for protection were a bit slow in regard to the numbers and the need to protect them. So that remains a challenge to it, but that I think has been a challenge around the world. The other one has been inadequate emergency. It's also lessons that we have learned. It's inadequate emergency safety spaces for survivors of gender-based violence during the hour of need. And this was also exacerbated by the fact that the restrictions of movement and staying at home for so many long hours that you could not venture out because of the control mechanisms spread. So it meant that if it happened to you at night, for example, if the curfew was starting at 6 in the evening to 4 at night, if a gender-based violence act happened during that time, it became extremely difficult for people to access services in regard to the violation. So that's a lesson that we have learned, and that also there was also a priority for gender-based violence, for example, a protection for women who are also working, shifted from provision of that service to that particular kind of violation, to put priority going to prevention and putting people to restrict people in the movement and so on. So that particular emergency measure, the emergency measures took all the focus, the priorities, so that GBV cases, protection cases were only discussed after the fact. So the first concern was what we do now about everybody, not just men and women, but everybody in terms of spread, in terms of containing the spread. Then also, there was a problem which we are still addressing on the management or the referral chain in regard to gender-based violence, not just protection for women alone, but also the management of the GBV referral chain. Where do you go when you receive the services? So that became a major challenge because the facilities were also overstretched, including the health facilities, were overstretched, and the fact that you could not access them during certain periods of the day. So those were important lessons that we learned, and also the government also embarked on tax cuts on incomes on particular levels and cadres in government, and especially for the lower income persons, most of who are women, and also on VAT. So this was able to cushion people also to be able to cope with the economic requirements at the domestic level, especially those who are earning less. So those are just some of the lessons that we have learned. I don't know whether I have been able to capture that, but we also have realized that we need to keep policies and programs that respond to emergencies evolving and growing, and are putting our national mind to events that may occur outside our budgets, outside our national plans, where we need now to put policies in place that will respond to such issues when they arise. So those are very important lessons that we have learned. And then also we have a continuous program.
Mr. Arira, I think your microphone may be cut out for a second. Are you still with us? So I think we're having technical difficulties with Mr. Arira's audio. And I'll chat him to move this forward. But I guess in the meantime, Agnes, I would love to kind of think about how you think the government and private sector could work together to help advance workplace protections.
Thanks, Michaela. So basically, as has been said, there are gaps in policies and everything. So I think particularly in Kenya, collaboration in terms of policy formulation between the private sector and even implementation, because in Kenya, sometimes you find that, yes, the policies do exist, but the implementation is the part that has difficulty. Most companies have difficulty in implementing, and you find that most companies want to do the bare minimum, not to go to the extra mile. So, but in terms of collaboration between the government and the private sector in both policy formulation and implementation, I think in implementation is that we do not, as most corporates do not put measures on how we're going to achieve some of these implementation of these policies. So we need to have like specific objectives that get measured so that they can get, the implementation can be done. I think secondly, there's a collaboration in enhancing accountability in labor standards between the private sector and the government. That is essential. And thirdly, I would say there is the need for establishment of grievance mechanism. As Mr. Ireri said, sometimes, and it was mentioned earlier, reporting mechanisms for any grievances, for any workplace grievances are not well, they're not well defined, or rather some employees may not find it easier to report any grievances and so on. So having an established grievance resolution mechanism between employers and employees would be a great step, even for both the private sector and the government to collaborate on. Yes.
Thank you so much, Agnes. I see Mr. Arira hasn't been able to join. Mr. Arira, do you want to finish your thought and also provide some comments around the partnerships between government and the private sector?
Thank you very much, Michaela. Previous to the COVID-19, we have had mechanisms to address those issues of protection, especially for women and vulnerable populations. But during COVID also, we enhanced this partnership. And Safaricom is a key partner in what we do. And especially for the State Department for Gender, we have what we call we have the National Committee on Gender Sector Working Group. And Safaricom is a member, for example. I'll just mention them because they are key partner among many other partners. And what my colleague Agnes has talked about are some issues that we discuss when we have high-level meetings. So that forum, then the National Gender Sector Working Group is at the highest level. It looks at some of the issues about the differential impacts of gender on many policies and aspects, especially COVID-19. So we have been able to come up with a structure that involves government, so civil society organizations, the private sector, who play a key role in this. And I can say the government was also able to partner, especially the Safaricom, I would say, because Agnes is here, in terms of cutting costs on the money saving facility, money saving and receiving facility in Kenya for the period February, March, when COVID was carried to the end of December, when that reprieve came to an end. So it was a strong partnership that was able to allow people, especially women who are disadvantaged, to be able to send and receive money at a reduced cost, actually at a certain amount at a free cost and progressively at a lower cost. So that facility of Gender Sector Working Group has 4 thematic areas, and one of the thematic areas called socioeconomic empowerment is actually co-chaired by Safaricom and others. And we have traveled this journey together. The other one is women in leadership, which is also, we have a partnership with the private sector. The other one is on gender-based violence. We're very critical, and which has played a very key role in the protection of women during the COVID period. And it has been active, having weekly meetings, for example, in order to address emerging issues of COVID-19 and actually informing national policies, including having a membership in the National COVID-19 Response Committee. So we have this partnership. Also, we have another thematic area, which we call Women, Peace and Security, which is exposed to United Nations Security Council Resolution 1325 on women, peace and security, which is very active. And through this forum, we have done what we call the National Action Plan on Women, Peace and Security, the second NAP, we call it the NAP. So it addresses issues of protection also, and we are escalating it to the lowest level, management level in the country. So we have, I'm proud to say, that national forum where we come together with the other stakeholders, and very key is the private sector contribution in that forum. Thank you very much.
Thank you so much, Mr. Rure. I just want to take this time now as we're kind of wrapping up to the end of today's panel to thank all of you for joining us today. It was an amazing talk to hear exactly how you guys outline some of the work that you're doing and really driving us to advance better policies around these topics. So thank you for your time and the work that you've done in this field. So we're really grateful for your time today. I'll briefly try to wrap up, if possible, some of the amazing thoughts of some key takeaways that I emerged from today. I think the key is just thinking about the difference between access and quality. So first challenge is access to paid family leave or childcare is lacking in many contexts. And even if it's guaranteed on the paper, it's not necessarily sure if there will be quality leave for everyone in the family. I also think our speakers raised a really important point around masculinity and gender norms and thinking about how care is not just a woman's responsibility, but it really is important to consider the whole household and what those household dynamics are at play. And then finally, I just want to highlight the importance to take intersectional approaches. I think we've been talking about gender writ large, but it's important to know how these intersect with class, ethnicity, race, et cetera, and thinking about how the most marginalized are the most affected during this time. So I want to thank you all for your thoughts here. And we're really excited to kind of explore some of these topics and women's work more generally through our Gender Economic Agency initiative. We encourage you to connect with us via email, and I'll share our email after we close today. So if you're at all interested in partnering with us to shape policies and programs on women's work, please contact us. We'd be excited to work with your organization to evaluate existing or planned programs and share evidence with you to help design effective policies. We're excited to announce that we recently launched our spring request for proposals that will fund randomized evaluations on Women's Economic Agency. More information can be found on our website or by contacting our team. Finally, Thank you again to our panelists and to our wonderful audience today for joining us. This has been an amazing event. I'm really grateful for your time. Please note that we also will share a recording of the event and slides with all registrants after this call. So please feel free to circulate that amongst your networks as well. So I'll share the slides with the contact information. Again, thank you all so much for your time today.